Yo, it is yours truly, Lemoi Desina, aka Mr. Kool Spot. Welcome, everybody, for another beautiful Saturday. Kicking it here at the Kool Spot. Lovely co-host Sherita Freeman. What's up, love? How you doing?
Hey, I'm well. How are you?
Nice, good. I'm well. I am well. So, yeah, it's been a beautiful day today, man. I've actually been working on a few different projects, and you know that there's been this whole thing about this killing and stuff that's been going on amongst the blacks in our own community. And there was a verse that I did with Javon Lunsford on the rap, some music, and I decided I wanted to go ahead and play around with that and turn into a little short video, for a performance, do the verse, throw it out there and see what happens. You know what I mean?
Okay.
But just, want to say rest in peace to everybody that's affected by the recent killings. Matter of fact, for all the killings that's been happening from the past few years with these rapping celebrities and just celebrities, period, or any loved one that one may have. My heart's really been heavy lately. And, I try to do one thing at a time. I try to, but you know how I am, free. I'll be all over the place.
Multitasking.
I honestly didn't feel like right now was the time to kind of get back into the music, but because of what's going on, I feel like we have to start talking about this and stop ignoring it and try to throw it off as if, oh, well, there's no such thing as black on black and killings in the black on black community. Okay, well, I mean, yes, there, no matter what you want to call it, like we got to name it something and address the issue,
right?
And I think that's the thing that I want to start kind of leaning more towards, because we're working on some big things for next year and dealing with that, raising awareness for that. So I'm looking forward to that, man. Looking forward to that. That's been my day, man. Yeah, how your day been? How you doing?
Good. Productive. Okay. One of our friends, Jessie Loren, has a organizing and cleaning services. So I had the pleasure of working alongside her today, and really, it's so oddly satisfying helping someone organize their life.
Yeah.
And I was able to, piggyback with her today, and it was really satisfying, you know what I'm saying? To just kind of like redo and revamp some stuff.
Yeah.
So yeah, it was super fun. So it's been that this morning, and just kind of jump starting with that. So it's been a very productive day, not as productive on the side of music wise, but I've been looking for some poetry today.
Yeah, good.
Good. I actually did some manual labor, actually. Okay, I actually worked on a lock. I wasn't able to finish it myself, but I started. Okay, with the drill.
Yeah.
And then I had to call back up.
Gotcha.
It's been a good day.
Okay, good. So today, before we get started, I want to say shout out to my man's Sam McSlungle. And Brother Sam, we had a great interview with him. That was yesterday.
It was a great build.
Great build on his network. It's going to be on his YouTube channel. We'll also have that out to you guys by sometime next week, Wednesday or Thursday. So we talked about politics. We talked about the difference between African Americans and also Africans in Africa, the perception difference. And we talked about discrimination. We talked about a lot of stuff, politics. We talked about life. Like, it was a really, really good build across the board.
It was
religion, American history, African history. It was a lot. We talked about culture.
What does it look like? Why does it look that way?
Yeah.
We're trying to unify ourselves and stop seeing ourselves as different people.
Yeah. So shout out to Brother Sam Mushunglo. It's hard to say his last name, but shout out to my brother, man. We had a good build. Good catching up with you, brother, if you're watching. So today we have a very, 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 very special guest, and he is my personal physician, my personal doctor, my go-to person, my accountability. Although I kind of fell off a little bit again, Dr. McLendon, but don't shun me. So, but from time to time we'll touch base early in the morning and be like, hey, get up and run. We got to go, and it's time to go. So, but I want to give a special welcome to my good brother, my primary care provider. He has done a lot with my health, with improving my health, and has just given me step-by-step instructions on different processes. He's a teacher, he's an educator when it comes to health, especially when it comes to men's health. That's going to definitely be our topic and discussion for today, addressing different things that men have to deal with. Trust me, if you are 35 and up, you need to be tuned in. If you know somebody 35 and up, please share this on their page. Please tag them in the post. Let's just get this word out, because health in the Black community has been something that we've completely been overlooking. We've been wondering, like, why did the Black community take a big hit during COVID? Well, there were a lot of, what they call comorbidities that were already in place. So within the Black communities, and those were the things that affected us, the reasons why we were affected the most, so those are the things that we have to be aware of. Please, let's take care of ourselves, because we're fighting for longevity here, not just as an individual, but as a community. So with that being said, no further ado, everybody, please give my doctor, my brother, my accountability partner, Dr. McLendon, a big round of applause and a big welcome. All right.
Hey, thank you for coming in today.
Yeah. How you feeling, Doc?
Oh, I'm feeling well. I appreciate the two of you inviting me back for this discussion that we're going to have today. So thank you for inviting me back, and it's good to be here for a second time.
Absolutely. And today you have a PowerPoint presentation that you want to share. And again, if anybody knows somebody 35 plus, please share this on their page or tag them to join. All right, because this is going to be some really, really good information, and we're going to do some really good building on this right here. All right, so yeah, it's on you at this point. You just want to go ahead and jump in. You want to get some background about yourself first. Get some background about yourself.
Sure. I am a co-owner of a primary care practice here in Raleigh, North Carolina, North Raleigh, right off Six Forks Road. And the name of the practice is Live Well Primary Care. The other provider in the practice is Dr. Daytanya Betts. So we both are the co-owners, and we enjoy providing good quality primary care to the community, and we offer a lot of great services in addition to primary care. We do weight loss as well as men's health. So we're providing a lot of things to the community.
Nice. And then you guys put a lot of focus on the holistic approach too, correct?
We do. Talk about, that integration of mind, body, and spirit, because it all, works cohesively together. So you want to address all of those components in order to live the best you can live, a healthier you.
Absolutely. That's the beauty of it. And that was the thing that really drew me to you guys when we've had our first interview. It was the holistic approach. And when we were able to tie it all in together, when we're talking spirituality, we're talking about mental health, and we're also talking about physical health. I was like, that's the thing. Yes, we can pray for healing. We get that. And I believe in God like everybody else does that believe that, there's power in the name, and that, there's healing in the name and everything else. But if you're praying for something and then you run right back to it, then it's like, what's the point of praying for it? So there's a disciplinary action that comes with this whole line or the mindset when we're talking about this holistic approach, or just being mindful of our health today, especially the older we get, the harder it is. I'm learning that firsthand. I wake up aching, free, and it's rough.
Look, I'm 32 arthritis, okay? I cream. I'm like, where's arthritis cream?
Yeah. But we're gonna go ahead and give you the floor, Dr. McLendon, and let's roll with it.
So I created a short PowerPoint presentation just to address some of the common things that men deal with.
Mm-hmm.
Again, you see my lead-in slide there. We're going to talk about men's health and some common illnesses and conditions that affect men. Again, I'm a provider at Livewell Primary Care. My credentials right there. And today we'll be talking about prostate cancer, hypertension management, cholesterol management, foot care, and there's supposed to be another bullet point in between foot care and routine health appointments. We're going to also talk about men's sexual health too as well.
Good.
Mm.
Good.
So we'll start off by talking about prostate cancer. The prostate gland, is a small gland in men and is part of the reproductive system. It's about the size of a walnut and sits low in the pelvis below the bladder. And it helps men make semen, which is the fluid that carries sperm. And over time, with age, that particular gland tends to grow larger, and men start to having issues with urinary frequency and urgency and dribbling, and those cells in and of itself that make up the gland can become cancerous, leading to prostate cancer. So prostate cancer affects the prostate gland in men. It's the most common cancer among men after skin cancer. About about 11% of men in the United States are diagnosed with prostate cancer over their lifetime, with the incidence rising with age. African American men now are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease.
Wow.
And found that statistic really striking. A lot of times when you go to the primary care provider, the provider may skip the digital rectal exam because they feel that the man may be embarrassed or not wanted, so they won't even talk about it. So this is an exam that is really important and should be done at every annual exam visit. Every guy, if you're 40 and older, should have a digital rectal prostate exam. So make sure your providers are doing that. It's one of the first screens that you can do for prostate cancer, along with the blood test called a PSA. Does that make sense? Any questions with that, Lemoi?
Is it possible that prostate cancer could happen earlier on in life?
Well, it depends on your family history. There are some risk factors that have been, linked to prostate cancer, and those risk factors can raise your chance of developing the disease. So men who are 50 or older have a higher risk of prostate cancer, and as I said earlier, African American men have the highest risk of prostate cancer, and the disease itself tends to start at a younger age and grows faster than in men of other races in African American. So if you have a father or an uncle who had been diagnosed with prostate cancer, then you would want to start your screenings more earlier than for maybe around like 35.
Right. So is it another question? Is it common, because I've heard the debate where they say, well, you could actually kind of reconstruct your DNA based off of how you eat. I don't know if you ever heard of that, but there's something, some communities talk about based off of what you can eat, or what you eat can actually be a determinant factor of the likelihood of you following the traits that the bloodline that may be stuck in the bloodline, if that makes sense.
I haven't read any stories like that or any studies like that. I mean, your genes are your genes, and you're born with those, and you can't change those. So I doubt the validity of those studies. But I think eating healthier can help, decrease certain risk factors like, alcohol, not doing any alcohol. Obviously, we know alcohol is a poison to the body and can lead to, cancer and other illnesses. So avoiding, unhealthy behaviors like that can obviously help decrease your risk.
Okay, good stuff.
Free
As far as that, I don't think I have any questions as of yet. I think it's very essential to know that providers are not wanting to or always administering the service because they feel like someone's going to be embarrassed. That's a big thing. And a lot of times that's already a stigma in the African American community, being scared of certain things or not doing things out of fear. So, just having guys taking control and saying, hey, can you check? I just want to be, safe. That's very essential.
Yeah.
Yeah. And some of the signs of prostate cancer are very, asymptomatic. Most men present with non-specific urinary symptoms, such as like blood in the urine or blood in their semen. But again, men who are 40 and older are especially at higher risk. And if you are at African American, you really should be getting that checked yearly on a yearly basis, right?
Okay.
Um, and as I said earlier, there's no proven prostate cancer prevention strategies, but you may reduce your risk of prostate cancer by making healthy choices such as exercising and eating a healthier diet. Um, some of the treatment for prostate cancer, if you are diagnosed, surgery and removal of the prostate is the treatment there. And a lot of times they'll do a biopsy just to stage the disease. If you have a Gleason score of 7 or greater, they recommend removing the prostate.
Okay.
And then maybe doing some radiation after it to make sure any residual cells are not present. That surgery does come with some side effects, erectile dysfunction, depression, and one thing I think providers do a disservice in when they're providing education about the surgery is that once your prostate gland is removed, they take your seminal vesicles too as well. So you will never be able to ejaculate again. And I think they forget to tell men that particular portion. This is very important for the guy to know that they will not ejaculate again. You will have the sensation, but nothing just will come out.
Okay.
A question. With that being stated, if you have your prostate removed, then you're no longer able to procreate, correct?
That is correct.
Wow.
Okay. So is there a method to, and I'm not sure, and I apologize for my ignorance in this, I guess, this area or this arena, but is there a way that a man can save or store his semen if he does want to have children after he's had his prostate removed?
Yeah, say for instance, if a guy developed testicular cancer, because testicular cancer is more common in younger guys, younger white men especially, and they definitely will have to have the testicle removed, have radiation. A lot of times, those guys will have sperm, stored or frozen, in case they want to have children later on. So you can always have, sperm removed and frozen, if you want kids later on.
Wow. Wow. I didn't know that about the prostate removal. I've never heard of that actually. Wow.
Okay.
Yeah. So that is my spiel on prostate cancer. Any questions with prostate cancer? Did we get any? Because I can't see the sidebar if anyone's typing.
I don't see where we've gotten any questions yet.
Not yet. And everybody, just to throw it out there while he's mentioning that this is interactive. So if anybody has questions, you can either go ahead and share it during the live, or if you'd rather wait to the end, because your question may be answered throughout the presentation. But we try to keep it interactive. So if anybody has anything that they want to share or just ask, then by all means, just drop it in the comment section, and we'll try to address it as soon as possible. So.
Yeah, and that's the takeaway point I want everyone to have, or the viewers to have from prostate cancer, is to make sure your screening starts at 40 and that your doctor is doing that, or your provider is doing that digital rectal prostate exam, as well as that blood test called the PSA.
Okay. Nice.
Now, high blood pressure. So what is normal blood pressure? Normal blood pressure is 120/80 or less. When should you take your blood pressure? The best time to take it is early in the morning when you first wake up. Make sure you're sitting down and resting for at least 5 to 10 minutes before you take your pressure. Make sure your feet are flat on the floor and you have the appropriate appropriate size cuff, and that cuff is at the heart level. I'm not a big fan of the wrist cuffs. I like more of the cuff that goes around your bicep. But if you have a wrist, make sure you use a wrist cuff. Make sure you use the left wrist, and again, you're holding that wrist at your heart level, and avoiding any type of caffeinated beverages before about an hour or two before you take your pressure.
Question:
Right.
Why the left wrist and not the right? Is it because your heart is on the left?
That's exactly right, Free.
Okay.
So
I was
smart.
like, wait, while I'm asking the question, I'm like, let me think of an answer.
Yeah, I didn't do that either. I guess I never thought about that either. Yeah.
Your pressure tends to run a little higher in the left arm than it does on the right because that heart is on the left side.
Nice.
Yeah. Mhm. When I usually don't diagnose high blood pressure on the first visit. You usually need two separate visits, and the patient's blood pressure is elevated. Then at that point, then I can make the diagnosis of high blood pressure for two consecutive blood pressures greater than 120/80. So when a patient is diagnosed with high blood pressure, I'm not a big fan still of going right away to medication unless they are really symptomatic. We talk a lot about diet modifications and lifestyle changes. And you see I have on the slide DASH diet. DASH is an acronym that stands for Dietary Approaches to Stopping High Blood Pressure. So it's all about eating more fresh fruits and vegetables and limiting your salt intake, because salt causes the water to hold on to fluid, therefore making your blood pressure higher. We do a lot of education around diet and food choices, especially shopping at the grocery store, because a lot of people don't know that sodium can sneak into different products, especially processed foods and canned foods. You want to try and stay away from processed foods and canned foods because they're high in sodium, because it uses the sodium to preserve the item. And we teach our patients the more they wake the more they work their way inside those inner aisles, the more and healthier that they get, and to try and stay on the periphery of the grocery store and pick more fresh items, which I know can be a little pricey. And so the next best thing other than frozen fruits and vegetables say fresh fruits and vegetables are frozen fruits and vegetables.
Yeah.
Okay. So that DASH diet is really important. Ways to improve your blood pressure: again, eating healthier, staying away from a lot of salt, processed food and fast foods, and exercising. Lemoi and I have talked a lot about this. With the current guidelines and recommendations, we recommend that you do at least 150 minutes of exercise a week, which boils down to about 30 minutes of cardio 5 days a week. I'm not so much focusing on weightlifting. I care more about cardio to help condition those arteries and blood vessels, therefore keeping the pressure lower. So I want you to focus on cardio and make sure you're at least doing 30 minutes of that 5 days a week, and staying hydrated and drinking plenty of water. We talked about how to take your blood pressure and the best time to do it, and then some of the organs that are damaged by high blood pressure include your eyes, your kidneys, and your liver too as well.
Yeah.
Mm-hmm.
So I have one throw this out there too, because sodium was one thing that I as me and you, as we began to grow together, and you were kind of figuring like different things that I need to change as far as my lifestyle and eating habits, I really started paying more attention to sodium. And like, I love soup. I love like chicken broth and beef broth and stuff like that when I do soups. And I didn't realize the sodium intake, the sodium amount in that in itself. So I've actually found a brand. I don't have it up here with me, but I have it some downstairs. But I found a brand that's like, I think it's like 30. The sodium is like 30% or something. It's like 30 or something like that. I can't remember what it was, but it's really low, But I didn't realize that. And I figured out that, yes, it does. it's really, really high in canned goods as well. At one point in my life, I was eating nothing but canned soups, and because I love soup, I love a good soup. So I would eat canned soup like every day, maybe 2 cans a day, or maybe twice a day. I don't know. It all depends on how I felt. But didn't realize how much that had an impact on me. And the second thing was one of the diagnoses that I had was the borderline diabetic and borderline diabetes. And I love that you mentioned that you focus more so on the cardio, because one thing that you told me is work what's going on around your waist area. So work on the weight around your waist, and you get that down, and that'll actually help with the whole pre-diabetes process, or the stage of pre-diabetes. So what other things can like the cardio help out with as far as preventative maintenance, if you have a few things on mind?
It'll help reduce your stress, which in turn will help also lower your blood pressure.
Yeah.
And as you mentioned, it'll help decrease the fat pad that's around the waist, because that's where most men gain their weight, is in their waist, and the neck area. So exercise is very beneficial mentally, decreasing that fat pad around your waist and conditioning those blood vessels to help your blood pressure stay low and help your heart stay stronger too as well.
Okay.
The more conditioned your blood vessels, your arteries, and your veins are, the less harder your heart has to function to pump the blood throughout the entire body. So that's why cardio is so important.
Nice.
Yeah.
All right. Good deal.
Any questions, Free?
No, not about blood pressure. I you know what? I think I did not realize until my dad, he was on dialysis, how much blood pressure ties into your kidneys. And your kidneys can fail if you don't control your blood pressure. My aunt and a cousin ended up on dialysis because they wouldn't take their blood pressure medicine. And that was my dad's push, like, take care of yourself because you're going to end up here. And I saw it occur.
Yeah. So untreated high blood pressure causes like hardening of the arteries. And your arteries and your veins need that elasticity for that blood to get through it. So the harder your arteries are, the harder your heart has to pump to get the blood. And that's why your pressure is so high, and that's why in your kidneys and in your eyes, the tips of your fingers, your toes, your penis, you have those small vessels, and your heart is having to work really hard to pump the blood and the nutrients through it. That's why those organs tend to be damaged a lot, because the blood can't get in there, because they're so hard and they can't relax to get the nutrients and blood in there.
Right. Wow.
You never think about how everything is tied into each other.
And a lot of men will not take their blood pressure medication and end up on dialysis, because one of the side effects, unfortunately, of blood pressure medication is it causes erectile dysfunction. So a lot of them will not take their blood pressure medication because of that reason. And unfortunately end up on dialysis, which I discouraged. I encouraged him to take their medications, and there are things that we can do to help treat the erectile dysfunction.
So let me ask you another question, doctor. Being that you brought up the erectile dysfunction, is that a common thing in younger years, like your latter 20s, your early 30s?
Yes, and that's coming up in a few more slides.
Okay.
I apologize. I didn't send you my slide deck before today. I should have said.
It's okay. Yeah, we're following along. We're good.
It's definitely coming up. So, but the big takeaway from high blood pressure is to make sure you're monitoring your blood pressures. And take them in the morning, and write down it in a diary and establish a pattern. And if your pressure is consistently greater than 120/80, then you should talk with your provider. Okay. Make sure you're exercising, eating healthy, and reducing the stress in your life too, and make sure you are managing your weight. So that's the big thing, the key takeaway points I want your audience to have with high blood pressure.
Yeah, that's good. Because I remember when I first came to you guys, my blood pressure was like what, like 150 something, 156 or something over, I don't know, like 120 something, 130 maybe. Something like that. Yeah, yeah. So it's like the holistic approach and working on the cardio, the exercise really works though. It really works. So I'm a testament to that. So yeah.
Yeah, you were under a lot of stress too, if you don't mind me saying. So and
Yeah.
you are getting it under control too as well.
Yeah. Yeah.
Mhm.
Cholesterol management. So cholesterol, we have let's see, about 4 values that we look at when it comes to cholesterol. We look at your total cholesterol, we look at triglycerides, we look at the HDL, and we look at LDL. Now you might be asking, well, what is all this? I'm like, oh.
Yeah.
So your total cholesterol takes into consideration triglycerides, your HDL, and your LDL.
Okay.
Triglycerides represent the amount of fat that's in your blood, basically your diet. Basically, so what I tell patients.
Mm-hmm.
Your HDL is your good cholesterol. So, and I really want your audience to remember that HDL is your good cholesterol, and your LDL is your bad cholesterol. L, the way I remember it and teach patients to remember it is L stands for lousy. So lousy is bad. So LDL is your bad cholesterol. You want that number to be low. You definitely want it less than 100. Okay. Your HDL is the good cholesterol. You want that to be high. Okay. Because your HDL is what removes the bad cholesterol from your body.
Right.
Your triglycerides, you want less than 150, and your total cholesterol, you want less than 200. All right? Got that, y'all?
Yeah.
Got it.
Yeah.
All right.
Remember you sent me that video. What was the video? Which one was it when they did the blood test based off of what people ate? They ran a blood test to kind of separate the plasma.
That was that documentary on Netflix I asked you to watch. I think it was What the Health?
What the Health? That's what it was. What the Health? Yeah, that's a
And
really good documentary. Yeah, yeah.
and the Game Changer. And I think that actually might have been in the Game
It
Changer.
was one of them. Yeah, it's one of them. I got it mixed up now, but it was interesting because they took some athletes and they fed them like burritos in the morning for breakfast. And the first batch, the first day they did the burritos with meat in it. I think chicken. I believe it was a chicken and beef, probably something like that. And then they waited it out, and then they did a blood test on a blood test to see what the plasma level is and separating the plasma from the actual blood cells.
Mm-hmm.
And they found more fat in the blood, like the cholesterol, what he's talking about, Dr. McLendon is talking about now. They found more fat in the blood versus them having like vegetarian burritos with just beans, you know, and guacamole and stuff like that. So like the guacamole and the bean burrito, they didn't have as many fat cells. And they were talking about the benefits of not having overly consuming like a high number of cholesterol, because it affects you in so many different ways of making you feel fatigue and everything else that he's mentioning here. So yeah, that was a really good point that I want to throw out there while I was thinking about it. Yeah.
And what Lemoi was talking about, whenever we draw blood, you have before you have to process it before you send it to a lab. And you use a centrifuge machine to process the blood and separate the plasma from the red blood cells. And generally, plasma should be clear. But if your diet is not healthy, your cholesterol is through the roof, that plasma is going to be cloudy. And that's what Lemoi is speaking of right there. The subject in that particular documentary who ate a lot of meat and not a healthy diet, their plasma was really cloudy, versus the one who were on the plant-based diet, the plasma was really clear, and it should be clear.
Yeah.
Let me ask you a question, Dr. Arnold. So, with that distinguishing difference between those that successfully ate meat and those that were on a vegetarian or more so vegan diet, do you have a support for one versus the other, or do you think it just means you just need a good balance?
I'm definitely more in favor of the vegan diet.
Okay.
But I know giving up meat is hard to do, and I don't want patients to give up things that they like. So I tell patients to at least try to limit their red meats or their saturated fats, because it's those fats that are saturated that we know clog arteries and blood vessels. So if you think about ground beef, when you browning ground beef and you drain the fat off of it, when that fat cools, it solidifies, correct?
It would. This what does the arteries, right?
And that's what it does to the arteries, yeah.
Mm-hmm.
So we teach our patients to eat more lean meats like fish and chicken and turkey.
What about venison? Is venison good? Deer meat?
Yeah, that's fine. That's fine. And I mean, okay with pork as long as it's pork loin, not bacon and sausage now.
Really?
Yeah, the pork loin is white meat.
Oh.
I like bacon, but you.
I thought it was the other way around because I do bacon and sausage, but I don't do the whole pork loin, pork chops, and all that stuff. You know.
Oh, pork chop is not a bad meat as long as you don't fry it because it's white meat and it's low in saturated fat.
Baked pork chops.
Yeah. Yeah.
Oh, you man, he took away your bacon.
Yeah, I mean bacon. Yeah.
And people who are at risk for higher cholesterol include, African Americans, have a family history of it, and then of course poor diets and lack of exercise. Having said that, though, if I have a patient who has an elevated cholesterol, I'm not quick to start them on medications right away. Again, I give them time to adjust their lifestyle and make better food choices, and usually I'll recheck their levels in 6 months and see what they are and see if those lifestyle and diet modifications have made a difference. There are also some over-the-counter supplements that I tell patients to take, like niacin. That's a good supplement that can help lower cholesterol. Fish oil that has DHA and EPA in it are good supplements to help lower cholesterol. And another supplement called coenzyme Q10. So those are three good ones that I recommend patients take over the counter before going to medication management.
Yeah, and that's what I love about you guys, because you're going to take the holistic approach first. It's not like, the other primary care provider I had with me and my daughter, we had another, I won't call the name, but we were somewhere else, and they didn't check with us with like a holistic approach and say, well, hey, this is always an option. It was always, well, we're going to prescribe you this medication, so go to the pharmacist and go pick this up. You know what I mean? And a lot of what you're providing as far as the fish oils and like some of the other supplements that we can get, it's actually a lot better than just jumping straight on the medication, and that's what I try to advise too. So that's good stuff. That's good stuff.
And again, exercise. Remember that cardio helps, lower the cholesterol too as well. And I can't stress the importance of stress management too as well.
Yeah.
So I think just make you all so approachable. And once someone's comfortable with their doctor, they're more likely to tell them exactly what's going on or what's wrong. They're less likely to shy away from it. So you all are so supportive.
That was me.
I'm not a big fan of a lot of the cholesterol medications. It's a big group that providers use are called the statins, and statins have so many side effects. It can cause mental fogginess, muscle aches and joint aches, and but I really stay away from those unless the patient actually really need them, and we exhaust a lot of other resources. Then I go to that route.
We have Angela Johnson. What's up, Angela? She says that she takes, how do you say that? Coenzyme
Q10.
Yeah. That's what's up. I do the fish oil stuff too now. I don't have that one, but I do have the fish oil and the I think that was the only one I did pick up from Walgreens.
And so I've heard some patients are, reluctant to take the fish oil because of a after burpy fishy taste that they get in their mouth if they were to burp.
Ooh.
So the way around that, I tell patients is to freeze the capsules,
Mm.
and take them frozen, and that prevents that after burpy fishy taste or
Wow.
it even get in your mouth.
Nice. Didn't know that.
Okay.
Mhm. Any other questions with cholesterol?
No, none right now.
All right. Foot care. And so I really focus on foot care because a lot of men just do not take care of their feet. And if you have diabetes, it's really important for you not to walk outside barefoot and to really make sure you inspect your feet on a daily basis because it's hard for sores to heal on diabetic patients.
Mm.
That's why you see a lot of them who get sores end up with diabetic foot ulcers and amputations and things of that nature. So
Mm.
for my diabetic patients, no, walking outside barefoot and make sure you inspect and wash them on a daily basis. All right.
Yeah.
Wear cotton socks. I don't want you getting fungal infections because a lot of men have issues with fungal infections. So wearing cotton socks can help with that. Using a foot moisturizer, any type of lotion would do. I like using Vaseline. I think Vaseline is the best moisturizer out there, actually. And I put it on just as soon as I get out of the shower from head to toe, actually. Keeping your toenails trimmed and cut straight across. Do not round your corners. Never cut corners or calluses off because you can end up with infection, especially if you don't do it right.
I do that all the time. I grew up cutting off corns, man.
Yeah, and it's okay for a guy to go to and get a pedicure. I think a lot of guys
Okay.
Yeah,
think
yeah,
just for women, but we should start taking better care of our feet and making sure that we are cleaning that dead skin away properly and safely. Okay.
yeah.
You can buy those pumice stones from the drugstore and keep them in your shower, and that can use to help remove the dead skin from your heels. And again, as soon as you get out of the shower, just make sure you just do a good moisturizer. And again, the one I go to is Vaseline.
Yeah, good stuff. I use coconut oil, organic coconut oil.
And monitor your toenails for any toenail fungus too as well. And that would be like dark looking toenails. Um, I don't like using oral antifungals because those are really hard on your kidneys. So what I use is like a little nail polish called Penlac that the guy can paint on their nail. It takes about 6 to 12 months to grow new healthier toenail, but it works. I've seen it work. So
Nice.
that's what I use the guys with toenail fungus. And then some other home remedies that you can do for toenail fungus include soaking your feet in apple cider vinegar soaks. That I've seen that help, and then Vicks vapor rub on the toenails too as well. I've seen that help as well too.
Oh, that's interesting. Wow.
Yeah, Dr. Arnold, I've heard a lot of different stuff with Vicks, right? I heard even Vicks is good to help you sweat. Like if you put it on, like to help before you exercise, it's supposed to help you sweat as well.
That is true. It seems good for erections, to be honest with you. If you rub a little bit on your penis, it helps to dilate the arteries and veins in your penis, and if they fill with blood faster. So
Get the hell out of here.
it does.
So okay, never mind. I'll wait till you get to that segment before I ask a question.
Yeah.
You're more gonna start laughing at me.
Calm down, we'll get there. We're gonna get there.
There's a lot of great benefits from that thick vapor rub. I guess our grandparents used it all the time, right?
Okay.
Interesting.
That was the real reason.
Yeah.
Didn't know that.
Mhm. Any questions about foot care in the sidebar?
No.
Nope, not yet.
Mhm. Now, men's sexual health, erectile dysfunction, low testosterone, premature ejaculation, and penile enhancement. So when you talk about erectile or think about erectile dysfunction, It affects almost all men at one time or another in their lives and affects more than 30 million men.
Wow.
About 80% of cases go unreported because men are too embarrassed to discuss it. All right. And the basic definition of erectile dysfunction is an erection that is not sufficient of sufficient quality required to have normal full sexual intercourse. ED is short. The short, it's called ED. Can be classified as organic or physiological or psychological. I'm sorry. With organic causes is something internally, physically calling it. Psychological is more mental. Okay. Some organic causes include diabetes, smoking, high cholesterol, heart disease, kidney disease, sleep apnea,
Wow.
liver disease, low testosterone, too much alcohol, and even marijuana. So all those are best examples of organic causes. And then, your psychological causes can include stress, depression, marital difficulties, financial difficulties, and even performance anxiety.
Wow.
The most primary care providers, as far as the treatment, will use a medication class called PDE5 inhibitors, which stands for phosphodiesterase inhibitors, and that's your Viagra, your Levitra, and your Cialis. The misconception that most men have is that they think they're going to take that though one of those three medications and they're going to get an erection right then and there, and that is so not true. The purpose of those medications is not to give you an erection; they help you maintain the erection only after you get it on your own naturally.
Right.
And they all work the same. The only difference in Viagra, Levitra, and Cialis is their onset time and then how long they last in the body. Viagra, see, was the first one that came out on the market. You take a Viagra, it kicks in about an hour and stays around in your body for about 8 hours. Levitra kicks in faster in 30 minutes, it stays around longer, 16 hours. And Cialis takes even longer to kick in. It kicks in about 2 hours, but stays around even longer, about 48 hours. It's oftentimes referred to as the weekend pill because most men take it on a Friday and they can go away for the weekend and not have to take any medication with them because it's going to be in their system the whole entire weekend. So just know if you take a Viagra that it's going to take an hour to kick in, but you have to have sex or intercourse within 8 hours when it's out of your system.
Yeah.
Levitra will kick in faster in 30 minutes, but it'll last longer, so you have to have sex within 16 hours. And Cialis kicks in 2 hours, but stays around for 2 days. Okay?
Yeah.
So that's how they work. All right?
So that doesn't mean that you'll stay hard like for 16 for the entire duration, though. It just means that it's going to be in your system, but it doesn't fully. Like, how does that work as far as the duration?
It's not going to get you hard at all. It's not going to get you. You can take a pill all day long. You're not going to get hard. You have to get sexually stimulated. And if you get sexually stimulated and that medication is in your system, it'll help you maintain that erection. That's how it.
Wow.
You got that, Free?
I know I come with questions, but I do. So I guess I was again, it wasn't something I was well versed in, and so I just assumed that the pill itself gave you the erection, excuse me, and not that it just aided in the maintaining of it.
Yeah. That's totally great. It just aids in the maintaining of it. It doesn't give you the erection.
So with a lot, I know you said like 80% of statistics are unreported when it comes to ED because of men not being or feeling comfortable talking about it. How should a woman encourage a partner if that is something that they deal with to go and see the doctor about it? Or is that something you see a lot of where partners maybe bring their spouses in to talk about it or kind of urges them to be seen?
I see a variety of both, actually. I've seen it where the guy has not told his spouse and he comes in seeking help and he don't want her to know at all. And then I've seen cases where the lady actually comes in with the guy, and actually is talking more to the provider than the guy is.
Yeah.
Let me
wanting
tell
her,
you what happened.
Yeah.
wanting her husband or her boyfriend to be fixed, you know. So I see a variety of both. But for the guys who are embarrassed about it, I think a good way to approach it from a lady's standpoint is if they notice something maybe or have the option with their female intuition is something maybe going on with their guy, it's just to talk with them, make sure that you provide that emotional support and reassurance, and they have to know that you care about them and you love them, and you're not going to leave them, and you're going to work with him to fix the problem and address the problem.
Yeah.
Mm.
One thing I want to throw in there too is when I did my physical with Dr. McLendon, like, I'm one that was kind of a skeptic when it comes to like just his ideology of saying, well, doctors are only just practitioners, and I can figure this stuff out myself. I've been like that for years. I can admit it, right? And it wasn't until like my health began to deteriorate, right, and I had to get some help. And when it comes to talking about sex, from a doctor and everything, and having to go through that whole physical process of doing it like a yearly physical, that means the full checkup from head to toe. It was the idea and the thought at first was a bit. I was nervous and I was afraid and I was a little embarrassed, and I was just kind of sitting in there like, okay, well, I know I need to get this done, but you know, I'm me, you know what I mean, with the mindset that I am, how I am free. So, but as he began to teach and talk about it and explain why this happens and why you need to be aware of that and give like the science behind it. Like he didn't just tell me, oh, well, you just need to get it to prevent this, but he said you need to do this because these are the different things that happen through the process before it gets to that, and that's what it helped me understand it differently. And I've actually gotten a lot more comfortable with just putting my guard down and just going in and getting the help that I actually needed. Um, and I tell anybody, like I told my daughter, like, yo, you want to know exactly where you are in case things get worse along the line, you at least have a start point to go back to. They say, well, at least I did a full body physical November 2020. It's November 2021, and I can say, well, I know at least from November 2020 that I was good up until this point. So let me take some steps back instead of trying to figure it out, playing the blind thing. Yeah.
And the reason why I saved men's sexual health for last and talked about high blood pressure, cholesterol, prostate cancer, and all those things before is all that ties into sexual health. Because if you're not managing that, your blood pressure and your cholesterol, then you're going to have issues in this sexual area. So I want you to be exercising. I want you to be eating healthy, managing your stress, keep your weight at a manageable level, and the men's sexual health, it decreases your risk of having erectile dysfunction. So I want to really manage the high blood pressure and the cholesterol and the diabetes to help manage better the sexual health portion.
Yeah, that's good. What was that? You showed me how to do something with going behind the testicle and pressing up and coughing.
Coughing the right, correct.
Yeah,
I was trying to bring it up, but they taught us like how to like check yourself, kind of sort of.
Can you talk about that, Dr. McLendon?
So every man should be doing a monthly self-testicular exam, and the best time to do that is in the shower because the scrotum is more relaxed, so it's easier to manipulate the testicle between your thumb and your finger. The front side of the testicle should be smooth, the side should be smooth, and the back has the epididymis that feels like a little bag of worms that holds the sperm before you ejaculate. That's normal. But if you notice any lumps or bumps on the front side or the sides that you haven't noticed before, you should bring that to our attention so that we can further investigate it because testicular cancer is a painless cancer. And a a lot of men have it and they don't know that they have it. They know they feel a lump, but since it's not causing any pain or problems, they neglect it or ignore it. So it's more common in men less than 40, but every man, no matter what age, still should check for their testicles on a monthly basis for any lumps or bumps they haven't felt before. Yeah.
Wow.
Yeah, so good stuff. That's good stuff, and that's the thing that again, we pushing this health thing, man. I love it. I think it's a great thing. Great thing.
I think I gave you a little pamphlet or leaflet rather to hang in your shower, like the women have the little monthly exam to hang in their shower. You can get one for guys too to remind them to do their monthly self testicular exam check too as well.
Yeah.
I gave you right, Lemoi?
Yeah, you did. You did. It's probably still in the folder, but I got it.
Lemoi, go hang in the shower. Try some before fall, okay? There's nothing wrong with you being safe.
Yeah, absolutely.
Yeah, go ahead on and hang it up so you everybody to do it. And again, back to that erectile dysfunction, just have those discussions with your partner and just make sure that he knows that you're there for him and support him through the endeavor of trying to get the issue addressed. I don't like it when guys do come to the office and without discussing it with their partner. I really want the partner to be involved, and I try to reiterate that to them. And then for subsequent appointments, the spouses or the girlfriend have started coming, and they feel so much better. Because hiding that secret or holding that secret can cause even more stress, cause even more erectile dysfunction. So that decreasing the shame and taking the stigma off of it, I think, helps a lot.
Yeah.
Can I ask you a question? Now that we're talking about this, so I've heard some guys in conversation because on the podcast lately we've been very open about like sexual energies and things of that nature. I've heard some people say semen retention is supposed to potentially assist with this. Is there any knowledge that you have on that?
What
help? Semen retention.
Female attention as far as what?
No, semen.
Semen retention,
not attention.
Semen retention.
Yeah.
Helping with erectile dysfunction.
I
haven't heard that. I haven't heard that one yet.
Yeah. We've been down this rabbit hole talking about sex transmutation, sexual energy, and stuff like that. That just came across one of our in our studies, is kind of looking into all of that stuff and trying to figure out the body. Yeah.
I'm gonna have to write that one down and do some research on that because I haven't heard anything about semen retention happening with the erectile dysfunction. So what are the school of thoughts behind that, or what you have heard? How did that help with that? Free.
He said like he just knew our research. What I was reading was just saying that I guess it's more so training a man's stamina. So maybe I don't know if maybe the process of I guess essentially it's almost like edging, like getting there but then not allowing yourself to. So I don't know.
It sounds like you're talking more about in the realm of premature ejaculation now.
It's almost like I guess to try to make it make sense the best I can. It's almost like that stimulation process. It assists with the stimulation process with being able to get erect. I don't know how, like, if it's a guarantee fix, but it's supposed to definitely help with that though.
Okay. I'm writing notes. I'm gonna research that. I'm gonna follow back up with you because I haven't heard anything about semen retention improving erectile dysfunction. But hey, it could. So let's need to do some research on it. And I'll get back with you on that one.
Sure.
Well, thanks, Doc.
Yeah, shoot you an email. All right.
I found the answer.
Yeah, we'll follow up too. That's good stuff.
Yeah. So. The takeaway with this erectile dysfunction is just to make sure you have those open and honest discussions with your partner. And if you have any chronic conditions like high blood pressure, diabetes, obesity, making sure you're managing those conditions properly, and cholesterol and et cetera. Okay. I wanted to talk a little bit about testosterone too as well, because testosterone is the male hormone, like estrogen is the female hormone. So it's a very important hormone, and it plays a role in erectile dysfunction too as well, especially if your levels are low. Our levels of testosterone are highest in our teens and our 20s. That's why when we are, in our teens, and Lemoi can attest to this, we always wake up with what we call morning wood, right? Erections.
Wood, yeah.
Yeah. And that's because your body naturally, your testicles naturally make testosterone at night, getting you ready for tomorrow or the next day's activities. So it's highest in the morning. So it steadily decreases throughout the day until your testicles make more testosterone that night for the next day. So does that make sense to you all?
Yeah.
So when our levels are as high as they're ever going to be, when we're about 20 years of age, then after 20, it starts to drop off about 1% every year until you hit 40. Then at 40, it drops off even more, about 2% a year. So we have that spike at 20, and then we have that steady decline downhill as we get older without testosterone. Now, testosterone plays a role in our frequency of our erection, the strength of our erection. It plays a role in our memory, believe it or not. It also helps to regulate our blood sugar. It plays a role in our libido. It also helps us to maintain our muscle mass and keep that fat pad down around our belly. So it's a very, very important hormone. If you have low testosterone, you struggle with erectile dysfunction, you struggle with weight gain, memory issues, you don't sleep well at night, and you decrease libido. So I started checking levels. If a guy come in and he's complaining of fatigue and weight gain, and erection issues, we usually check the testosterone level. The range of normal is really, really wide for testosterone. It's anywhere from like 250 to 1100. Having said that, though, I know most men feel better if their levels are between 600 and 1100. So that's where I want you to be. If you're less than 600, then I would highly recommend that you consider testosterone replacement therapy. You see a lot of things on the TV about, this pill and that pill increasing your testosterone level, and those are all a lie and a myth, because they don't work at all. The only way to raise your testosterone level is through testosterone injections, or some type of topical testosterone preparation. And you can also do pellets that are inserted under the skin now too as well. But anything over the counter pill that said increase your testosterone is not true, and you're just wasting your money.
Wow.
Wow.
Yeah.
That's like doom right there. So what about like I guess like exercising, and I mean all of that will help with the testosterone as well too, though. I'm trying to just focus on the whole health aspect.
Exercise can help, but still, if it's at a low level and you're still struggling with fatigue, and the only way to get it up is through some type of testosterone supplementation. Now, if you are of childbearing age, your provider should be talking to you about not only treating you with testosterone, but another medication in addition, either HCG or Clomid, because if we were to just treat you with testosterone only, then that would knock out your testosterone, your testicle testosterone making capability, as well as your sperm making capability, and would leave you infertile. So you don't are sterile. So if you are childbearing age, you want to be treated with testosterone as well as HCG.
Wow. So what's replacement therapy? What does that look like?
I like the injections or the cream preparation. I'm not a big fan of the pellets that are injected under your skin or inserted under your skin, because you really can't titrate the dose once the the pellet is inserted, it's there for 3 to 6 months, and you can't really titrate your dose with that way. But you have more control if you use the cream or the injections. You also have some gels, but I'm not a big fan of the gels because depending on how much you sweat or whatever, you can sweat the gel off and not get that absorption of the medication.
Right. Interesting.
Mm-hmm. Mm-hmm. But again, it's a very important hormone. If you're struggling with ED, I always check a testosterone level, or if you complain of fatigue, I just make sure that your testosterone is okay.
Wow. Yeah, that's something that I think outside of just knowing about cholesterol and everything else that you mentioned, like testosterone is something that I think is definitely overlooked. And yeah, that's good. That's good to know. Good to know. Wow.
Now, there are some supplements that I do like that will help increase testosterone, and things like Tribulus. Have you ever heard of Tribulus? Tribulus.
Mm-mm.
It's a good herb that can help naturally, and it can help your testicles produce more testosterone.
Okay.
So, if you're looking for over-the-counter supplements that actually have scientific data behind them to increase your levels, Tribulus is good. Again, that's spelled Tribulus.
Mm-hmm.
Mm-hmm.
Now it's no, because I know that and I can be a conspiracist here with some of this stuff that I'm going to throw in the air with you. All right, so it may be I might be a conspiracist. I might be right, but I think that they've been looking. I believe the government. Let's just go with this right here. I think the government has been leaning more towards trying to keep majority of the people sterile with what's been placed in the foods and even medications that's been pushed upon the people. And are there anything that you may know of that we should stay away from, like as far as any kind of medication that could actually contribute to the low testosterones in men and stuff like that, or anything that could actually affect the hormones in human beings, that foods or medications or anything like that? Do you know of anything that we can stay away from?
Well, I'm not a big fan of conspiracy theories. But again, as I was, said earlier, that our testosterone level in and of itself, it starts to increase anyway after 20 years of age. That's just part of the aging process. Our levels are going to decrease over time. Now, there are certain medications that can decrease your testosterone level too, and those are like antidepressants. They will decrease your testosterone level.
Yeah.
And then certain antifungal medications used to treat toenail fungus or topical skin, fungal infections, those can decrease your testosterone level too as well. So I'm mindful about not prescribing those if my guy is struggling with getting his testosterone levels up.
That's good stuff. Wow.
So, okay, I have another question. So, being that I know you said that ED can either be organic or it could be psychological, for those that deal with the psychological component, if antidepressants also cause it, what would be their way out to being able to keep sustain and not have to deal with the ED factor?
Mm-hmm. So with the psychological or the mental aspect of ED, you want to get to the root cause of it, and if it is more mental, and they're struggling with depression or anxiety or something like that, then they may need to be on an antidepressant. If it's something other than stress, or they just worried about finances or whatever, then we may get around that with just do some counseling and verbal therapy, relaxation techniques, and things of that nature.
So still the homeopathic way of like, hey, let's get to the root cause. Let's fix that. That'll fix the actual issue. Okay.
Yeah, I'm a big fan of, having patients keep diaries and have them write their feelings in the diary. Because a lot of men, they don't want to talk. And then when they are to that point of where they are ready to talk, then I think journaling helps them get there quicker than just keeping it all bottled up on the inside. Because the more you keep it bottled up on the inside, the more problems you're going to have that's going to manifest themselves physically.
Okay. That's interesting. I mean, it makes complete sense. Anytime you have issues, you gotta kind of bring it up, talk about it. If not talk about it, write about it, and until you're ready to speak on it. Okay, Doc.
So I mentioned that tribalist supplement earlier, and again, that's spelled Tribulus. That's a good over-the-counter supplement to use to help ED. Niacin is another good one. When we mentioned niacin earlier for cholesterol, but it's also good for ED. Mhm.
Okay.
And then the fish oil too is again good for ED as well. And red wine and grapeseed extract is another one that I like. It has a lot of nitric oxide in it.
Now,
And what was that?
nah, I said, come on now, red wine. I do the red wine.
Yeah, and you can buy the red wine and grapeseed extract tablets, and they're really high in nitric oxide, which is a great a precursor for erections, and it helps that vasodilation. So again, those supplements are red wine and grapeseed extracts, niacin, omega-3 fish oils, and the tri. I like all those.
And you guys also offer the nitric oxide out at your facility as well, right?
We do sell that. We sure do.
Because I purchased a box, and that stuff is awesome. It's pretty good.
Yeah. And then certain foods like broccoli, cabbage, Brussels sprouts, pomegranate, real pomegranate juice, foods like that help to inhibit an enzyme in the body called aromatase, and it's the aromatase that breaks down our testosterone into estrogen. So therefore, eating more foods like that helps keep more testosterone around.
Nice.
So again, it's broccoli, cabbage, Brussels sprouts, bok choy, and pomegranate juice.
Pomegranate. Gotcha.
Okay. Now let me ask you a question, only because you said it early. So when we're talking about the Vicks Vapor Rub, right? Remember you were saying that it is something that can be used on the penis as well to help with dilation. So what is that process? Is it used and then you wash it off, or?
You can rub it on there and then cover the shaft with a condom so you won't transfer any to the female.
Oh,
interesting.
That is interesting.
Yeah, that's what I tell my guys to do. Yeah,
that's a life hack right there. Cheat code.
It's a DIY. This is a topical conversation. Teen Summit. Have you ever heard of Vicks Vapor Rub's multiple uses?
Right. That's interesting. Wow.
Yeah. Hey, if it'll open up your nasal passages, it'll open up those veins and arteries down there too.
It makes sense.
That makes sense.
Yeah.
Okay, so let me ask you another question because I like uncomfortable questions. So if you can't tell by now, so when we think about men's health, and especially when we're dealing with sexual men's health, are there things that are not good for men's sexual health, like when it comes along the lines of I'm trying to think of a nice way to say this. Like, okay, for instance, if someone feels like they're having an issue with staying with ED, right? But they want to try like a ring or something, is that a good thing or is that a bad thing to do?
Oh, that's a good thing. We even had rings out at the clinic to our men's who are in our men's health program. Because it helps, especially as men get older, they can develop what's called venous leaks in the penis. And a venous leak is when you get erect, but then the erection just fizzles out really quickly. So that means the blood goes in there and then it leaks back out slowly until your erection goes down. So having that, I think you call it a penis ring, but we call it a cock ring.
I was trying not to, use slang. I was like, well, what's the politically correct name? Maybe
having that cock ring on will, provide that friction at the base of the penis and hold the blood in the penis, keeping it erect longer. So yeah, I'm a big fan of cock rings.
That's interesting. Wow.
And I'm a big fan too, Free, believe it or not, of men using penis pumps just to exercise the penis and keep it healthy. Because when you think of the penis, you only get a good amount of blood in there when we get erect, right?
Mm-hmm.
Right.
So you want to use a penis pump frequently just to exercise the penis and keep those tissues stretched the way they should be. Yeah. And it has to be a good penis pump. I don't want a cheap penis pump from Adam and Eve or what's the other place called? I can't remember right now. But get a good penis pump from that's a real good one. I'll give you the name of some Lemoi.
Question. So with that, right? So I used to work for an insurance company too. Couldn't they technically receive the penis pump as a durable medical equipment?
No.
I tried, guys. I tried. Not covering that. No.
Now, having said that, though, if you may, have a diagnosis of some type of neurogenic condition with the spine, it may be a possibility you could get an order for a penis pump, and they will pay for it.
Interesting.
Yeah, it is interesting.
Wow. See, this is why you have to talk to your doctors, ladies and gents. Because this is just stuff you would never know. You would never think your doctor would just be like, hey, yes, use this, use that. It's okay. Yeah. A lot of times we think it's so taboo to open up about sexual health. And they went to school, for these things to be able to assist us. So we just have to open the floor and have the conversations to find out.
Mm-hmm. And at LipWell Primary Care, we do have that men's health, program that we offer, and we talk about all this during the initial consultation.
Yeah. That's because again, there's a stereotype that comes with all of this too in the Black community. I don't need a doctor. I'm good. And he would be dying. If I never made up my mind to just go, I probably would be in a worse off condition right now than where I am today. If I ignored what my body and my mind was trying to tell me, you know what I mean? And and they make it so easy. They're so easily approachable. If you have questions, I can call Dr. McLendon. I don't just blow him up any time of the day, but I can ask him anything. And we actually have a relationship, a friendship. We have a bond, and I think what everybody should be looking for when it comes to a primary care provider is trying to have some kind of bond with them, because there's a trust level that comes with that. And it's like family. It's what it feels like. So, yeah.
And it's for me and for my business partner, Dr. Bess, it's an honor to be a part of our patients' lives, because we are a part of their lives. And you want to have that trust and that relationship. And the further that's developed and defined, the more our patients will open up with us and trust us. And you want that in your provider, to be able to have that relationship and talk with them about conditions, Yeah.
Absolutely. So yeah, man, if you do not have a primary care provider, a doctor, somebody that you can, talk to about whatever's going on, hey, I'd like to be the first to plug LipWell Primary Care. Definitely check them out and get information scrolling below, and check them out, man. Very, very good people, very thorough, very, very knowledgeable about what they're doing. They don't just tell you. It's like having one of those traditional parents that just tell you to not do something, but don't give you the reasons why. That's not what you're getting here. I know that's probably the mindset, but that's not what you're getting. You're getting the reasons why and the processes that's part of the reasoning why you should not. And you know what I'm saying? And it's just a beautiful thing, man. It's always educational. And that's how I move. I have to be enlightened. I need to be informed. I need to be in the know before I make a decision. So, yeah, good stuff.
And we're going to be updating our website pretty soon, just to be more reflective of the services that we offer other than primary care, because a lot of people just don't know that we do a lot of weight loss as well as men's health, and we're just trying to really get our name out there and let people know so that people will not be suffering in silence.
Yep.
Now, I also want to talk a little bit about premature ejaculation, because a lot of men suffer with that too as well.
Okay.
It's premature ejaculation is defined as, ejaculating, within a minute or so after penetration, or not lasting long enough for your partner to reach her climax. So we talk a lot about premature ejaculation. A lot of men suffer from that, and again, they don't talk about it. I tell my guys, I want you to be lasting for at least 20 minutes in the bedroom, because we know it takes most ladies 20 minutes to reach orgasm. So that's what is my goal. If you can last longer, then great. But our goal is to really get you there into the 20 minutes. So we talk about a lot of different little techniques there in the office that guys can use to help treat premature ejaculation. One of the medications that I use is low dose daily Cialis. It's not the erectile dysfunction dose, but it's the what I call the penis health improvement dose, and it's been proven to help decrease that sensation so that guys can last longer in the bedroom. And that's low dose daily Cialis. I use that a lot. I also I teach the guy about the pressure technique. The most sensitive part of the penis is the frenulum. Do you know where the frenulum is, Lemoi?
No, sir.
So, under Frida, you know where it is?
So is it the portion right under the head of the penis?
Exactly. It's exactly where it is.
Okay. Where Free?
Now, Lemoi, how did Free know that and you did not know that?
I don't know.
He just ain't know the name of it.
Yeah, there you go. Thank you. I didn't know the name. That's all it was.
Well, that's the most sensitive part of the penis. So it has a lot of nerve endings there. So if you're, working with your partner and you feel that sensation that you're about to reach your climax, I teach the guy to pull out, and either the guy can hold pressure right there or the female can hold pressure right there for about 5 to 10 seconds until that sensation goes away, and then insert and start back working up again. So that's called the pressure technique. Do that about 3 or 4 times, and that'll help retrain the brain to last longer. As you recognize that climax sensation.
Wow.
So we talk a lot about that. And usually that's really, really good for my guys who are not circumcised to use that technique, because if you're not circumcised, then you're even more sensitive in that area. All right. And then a third method that I use is, you've heard of lidocaine cream, correct? Or aspirin cream over the counter.
Mm-hmm.
Well, aspirin cream has a little lidocaine in it, and lidocaine is a numbing agent. So I teach the guy just to rub a little bit, not a lot, but just a little bit, on that frenulum, that little area right beneath, on the penis.
Yeah.
It'll numb those nerves so that you can last longer too as well.
Wow.
I feel like I've heard that before, but it makes sense.
It makes sense.
So those are 3, free techniques that I just gave your viewers so they can try.
We should, you know what, though, Free? I think we should start writing some of these notes and pointers and stuff in the comment section. With the algorithms too, by the way, just thinking about it. But yeah.
Right now. Tell them they're supposed to come to class to get this free knowledge, okay? But if you want to put in the comments, we'll be nice and put in the comments, but
Yeah.
But yeah, that really, really helps. The low dose daily Cialis, the pressure technique, and then just rubbing a little bit of that lidocaine cream there. Not a lot, like I said, just enough to numb those nerves, and that'll help the guy last longer.
like
and then What was that?
What the doctors always say, just use a little bit, like a pea-sized amount, the size of
yeah, pea size, yeah.
Yeah. Mm-hmm. And then you got to remember, you're running a marathon and not a sprint. So
Right.
you just be, fast sometimes and slow sometimes. Or don't just try to you know what I mean.
You gotta rest something.
Yeah.
Interesting. See, I think this is so good that we can have these conversations and we can laugh and we can giggle, but we're still getting the knowledge that's needed that we can share with someone else and that someone can grow from.
Yeah.
Mm-hmm.
And again, you know how it is when we started talking about the other sessions that we've had when we talked about the powers of sex and stuff like that. I don't know. I don't think I still believe that a lot of us as in the Black community are uncomfortable with talking about that publicly. So that's just going to probably be an ongoing thing. But at least we're going to do our part here at the Kool Spot. You guys know here at the Kool Spot is the place where creative millennials meet. So it's all about the information. We are, as millennials, when it comes to information, what the elders were to us. Now we are the next generation. So for anybody that's watching, that's just what we're about. So don't take none of this wrong. We have matured and real and relevant conversations and things that we should be discussing more in our community. So thank you again for all of this. It's good stuff.
Yes. And then the last thing that I wanted to touch base on was just the penile enhancement, because we do offer a penile enhancement procedure there at LiveWell, and that's using shockwave therapy.
Yeah.
And shockwave therapy is not new technology; it's actually old technology that was first used years ago in urology when patients would present with kidney stones. They would submerge the patient in a shallow pool of water and send shock waves through the water through the body to break up the stones so the patient could pass on their own naturally. They found when they did that the patient would experience an increase in new blood vessel formation in and around the kidneys. So orthopedic surgeons got wind of that and they started using shockwave therapy to help repair damaged ligaments and tendons in athletes. Now the technology is being used to help treat erectile dysfunction by improving the overall blood flow and circulation in the penis itself. And there's a lot of research behind it, and it really works. I think if I'm asking a patient to do something or doing a consultation on something, that I should at least try it myself, and I can attest to it that it really, really works, and it's a good, really treatment modality. The patients who have had it experience an overall increase in blood flow and circulation to the penis. You even notice new blood vessel formation on the penis itself, and more stronger and frequent erection. So it's a really, really good treatment modality that we offer there at LiveWell Primary Care.
Yeah, they've been promoting that I've been hearing more and more about that on the radio here recently too. And I don't know if it was on the Hannity show on the radio. It was one of those stations. They were actually talking about promoting that. But then I was watching Law and Order with my daughter last week, and I was at her place watching Law and Order, and there was a lady that was actually drugging people, celebrities, right? One of the episodes, it's kind of interesting. So she was drugging, she was going out meeting up with celebrities, and she would drug them, take them to her room, and that's pretty much all they remember. They never had sex with her, but she ended up pregnant, right? So then at the end of it, they found out that she used one of these tools that you're talking about in order to extract semen from men, according to what they said. And you can help me out with the interpretation of this, but according to what they said that this was something that was used like back in the 80s or something like that. If somebody was going to be sterilized, but they want to save their semen, but they couldn't get it up anymore to ejaculate, they were saying that they used one of these tools because of the electrical current and stuff like that. They put it up there, I don't know if it was in their anus, or the same process you were talking about, but it caused the pre-ejaculation to happen or the ejaculation to happen for them without them actually getting hard. And that's how they were able to save and retain the semen in case they want to have babies in the future or something like that. So, yeah.
So, and I can see that happening. Yeah, anything's possible. Yeah, I can see that happening.
Okay.
So the procedure in and of itself, it uses like a little wand-looking device to send sound waves throughout the penis and the perineal area, targeting the tissue underneath the skin and damaging it, and then it tries to repair itself by growing new blood vessels and tissue. So that's how it works, and it really does work. It's a very good treatment modality. It doesn't. There's no anesthesia involved in it. There's no downtime involved in it at all. Some patients may ask for a little numbing cream to be applied before you begin the procedure, but most of my patients don't require any numbing cream.
So I have two questions with that. So is this similar to like the flip side of like pelvic floor therapy? Is it like the equivalent?
No. I think the pelvic floor therapy is more so you are retraining your pelvic floor muscles by contracting and releasing them, which is a really good exercise too for both men and women. So I encourage everyone to do pelvic floor exercises on a daily basis. Yeah.
Okay. I did say I had two questions. Let me think what the other one question was. So, the second question for the penile enhancement, is that something that's covered under insurance, or is that something that someone will be looking to cover out of pocket?
That would be out of pocket, actually. They won't cover that.
Gotcha.
But I would stress to your viewers not to go to a men's clinic and have it done, because the prices are astronomical at just a clinic that focuses on men's health, period. And because I used to work at one, and I know that's one of the reasons why I left, because I said that I could offer the service to my primary care patients at much more of a discounted price, and also address their other issues and not just that issue. Because if you're just focusing on the penile enhancement and the shockwave therapy, but yet your testosterone is low, your diabetes is not properly controlled, blood pressure is not controlled, you're still going to struggle with issues in that area.
Right. Wow, that makes sense. That makes a lot of sense.
So y'all are a one-stop shop for all the things you need health-wise, holistic. And if we got to do the medicine, we'll help with the medicine, and then we'll ensure that you're able to have a life that is fulfilled in all its aspects.
Yeah.
Exactly. Yeah, and we do it at a reasonable cost. We don't. We're not trying to break anyone's pocketbook.
Yeah, and for you, like I told you, like it was mandatory that I get a full physical. You know what I'm saying? Like the ends and
you were if y'all know me and Lemoi, we are very much so like big brother, little sister, and I'm like, it's okay, just do it. And he's just like, you gotta talk about the other stuff.
Yeah.
I was like, why are you more bashful than I am? I'm the one like, let's talk about it. Da-da-da. You like,
well, see, my thing is I've always had female doctors. You know what I'm saying? This is my first time having a male doctor. So like I've never really had to check in and explain and talk about stuff like that with another male doctor before. So it's all new. It was all new to me,
It's almost like accountability, isn't it?
Yeah, it is. It is. But he made it easy though. He made it easy to understand. You got to teach me. If you want to win me, you got to teach me something. You know what I'm saying? That's how I make my moves. So yeah.
I remember that's the first thing he told me, Dr. Arnold, when he left. He was like, he taught me during the whole time.
And I was sometimes asked the patient, I'll say, am I talking too much? I need to shut up.
No, keep talking. I mean, he's giving information like this is why this and that's why that. This is
right.
Like, okay. Oh, okay.
See, once you understand it, then it's easier to swallow, even if it's something you have to work on. Because Lemoi was just like, yeah, I'm about to do this weight challenge. We got this to work on, and it's a good thing because then everybody around you can be supportive of what you have going on, and not bring egg rolls and stuff like that.
and Lemoi can tell you, I like to do my blood work before the physical exam so that I can see down with you at the physical and discuss all of your blood work face to face.
Yeah. Yeah.
I just think it's more of a robust and better conversation to discuss lab work face to face.
Yeah. It's good stuff. I really appreciate it. And I feel a lot better mentally, physically, and all that affects what happens spiritually too. So I feel a lot all the way around, man. I really do.
Mind, body, and soul.
Mind, body, and soul.
Yeah.
Ooh, routine appointments.
So routine appointments. I just want to stress the importance of, having a yearly annual physical exam. And then if you have any like chronic condition like diabetes, we see you every 3 months at that point. Or if you have high blood pressure, we see you every 6 months, or high cholesterol, we see you every 6 months. So we're good about making sure those appointments are on the books, and we're good about following up and making sure the patients keep those appointments. The purpose of primary care is just that, primary prevention. We want to stop things before they happen and detect conditions before they get bad, Early treatment is the key. Developing a good relationship with your provider, keeping those follow-up appointments, and just making sure you are attuned to your body and doing those things to keep you healthy, not waiting until you get sick and us trying to get you back healthy again.
Yeah.
Then that's a little flyer right here about our men's health and the shockwave therapy that we do here that we talked a little bit about earlier. This is my partner's weight loss flyer. She's doing an awesome job with that. She has one client that has lost 60 pounds actually. She wrote a nice testimonial for us on the website and how she has really changed her life. With no surgery or anything, just following the program.
Wow, that's beautiful.
And then that's our business card right there. Contact information.
Yeah,
that's it.
That's all, folks. This was good. This was really good. This was really, really good. So you see why I feel it was so easy for me to just go ahead and just submit and make all these changes and face things I never faced before. And he's a teacher. He's he makes it so simplified and you can't misunderstand what he just said. So this is beautiful. This is good.
I got my little child right here with me. So.
Is that a poodle?
Yeah, it is a little poodle. Yeah.
My neighbor has a full-size poodle. I've never seen a full-size poodle before. Only like the teacup poodle.
Big one there.
In awe. Like me and my daughter get to see Ace every day, and he's bigger than a regular poodle. So I'm just like, he looks like the show poodle. I'm like, oh my gosh.
Yeah. He's my shadow. He's always just right here.
He's like, what's going on? Let me tell you about what's going on in the appointment.
Well, no, this is good. Go ahead.
If you get any additional questions from your viewers, just feel free to let me know. I don't mind answering any questions that may come in after the presentation is posted to YouTube.
Okay.
All right. Thank you. We definitely will send them your way. We appreciate you coming in. Again, y'all, this is Dr. Arnold McLendon. He has over 20 years of experience. And check them out. If you're looking for a primary care doctor, if you don't know where to find one, please check out Live Well himself or his partner, Dr. Daytanya Betts. Please make sure that you check them out. I'm still debating. Like now, I almost really want to change my doctor's office. I love them. But I'm thinking about it. But I think it's phenomenal to be able to have doctors that are personable, that you can talk to, that care about you, that care about your well-being, and want you to be the best version of yourself that you can be. So.
Yeah, and they're one of them free. Yes.
Or you just can't go wrong with that. You can't go wrong with that.
So we got to support Black, man. I think it's a beautiful thing, though. Beautiful thing. Yeah.
And thank you guys for having me again. I really do appreciate it.
Of course. Does anybody have any closing remarks?
No, I think that's it. I do have, like I said in the beginning of the show, we have an interview that's coming out next week. With our good brother Sam Mushlungo. We talked about a lot of different subject matters, a lot. And you guys are really going to enjoy that. We may even be able to break it out as a short series. We're actually working, we're actually working to do a series with the good brother, and we're going to have him on as a guest as well. We're looking to do a pre-recorded show next Wednesday, and we'll release that Saturday. So next week, Saturday. So that way, you guys don't miss out on everything that we've been doing. I have a short video that I'm going to release. Hopefully today. It's 5:40. I'm almost done with it now. But you guys see all of the different killings, the murder rate amongst ourselves in our own community. And I just, for those that don't know, I'm a rapper first. So you guys may see me do a lot of different things. But I'm a rapper first. So if I do anything that I take pride in the most, it'd be the rap. You know what I mean? That's just me being honest. Not to toot my own horn, but that's my first baby, right? So, but yeah, so I'm looking to release something today, by the end of today, within the next maybe 2 hours or so. And super excited about it, man. Super excited about it. It's been a minute since I've dropped something on musically. So looking forward to that. Yeah.
Did you watch that documentary Out of Darkness that I mentioned to you?
I did. I watched both of them. I watched the Out of Darkness and what was the other one?
Contradiction.
Yeah.
You sent me Contradiction. I didn't watch it yet. I've heard.
Okay.
I took a lot of notes from Contradictions and both Out of Darkness too for the interview we had yesterday, but we didn't really get to discuss in depth like everything, because we were just it just flowed. I wanted to be organic. Yeah. So next weekend, next time we link up, I definitely we'll start talking about that, and then we'll bring him on the show and do the same thing. So yeah, it's good stuff though. A lot of good information.
Yeah. Well, I look forward to all the new stuff that'll be coming out with your music that'll be coming out within a couple hours, Lemoi, with the additional meetings that we'll end up having with the doctors. Just with all the great stuff that's coming, this is the season where we have to stay together and, be protected and be safe and talk about these issues. So thank you again. If you are a doctor, follow the information below, okay? You can go read the reviews. They're amazing. So, why would you not, okay? They want you to live well, spiritually, mentally, and emotionally, okay? So let's make sure we support them as well in their journeys. Thank you for checking out the Kool Spot. As always, check us out on Instagram or Facebook at the Kool Spot NC. Lemoi is Mr. Kool Spot, Mr. Lemoi Desina. My name is Free, also Sherita Freeman. Find me on Facebook as well. You can find us on YouTube. Don't forget to like our Patreon as well. And
Dr. McLendon too on Instagram.
Dr. McLendon, okay. All right. So thank y'all. We hope that y'all have a phenomenal remainder of your day. Remember, routine checkups are essential for our everyday health. Okay. And we'll check out next time.